It is my pleasure to introduce our next speaker. Next, we're going to have Jagmeet Singh, the leader of Canada's NDP, come up and speak. As we all know, that the best things in Medicare in our country have come in a minority government. We heard the speech from Tommy Douglas from so many years ago that a minority government delivered on Medicare, and then we have seen in the last couple of years a minority government deliver on the Foundation for Pharmacare as well as the beginning steps of public dental care in our country. We know that couldn't have happened without the leadership of Jagmeet, and so please welcome me enjoying Jagmeet to the stage. Thank you.
Well, thank you very much, Siobhan. A big shout out to Siobhan, Vice President of the CLC, and also Vice President of our party. Very honored anytime I get to see Siobhan. Friends, there is a very wide room, I realize, so I'm going to have to do a lot of these kind of actions here. First of all, I want to acknowledge that the folks in this room, you are healthcare providers, healthcare advocates. You are the ones that passionately believe in defending our public healthcare system. You're the ones that fight for healthcare, fight for the folks that you work with, your colleagues, and I want to thank you for the work you do each and every day. I appreciate all of you. You should probably give yourselves a round of applause for the work that you do. And I was thinking a lot about the vision of Tommy Douglas, the fact that he delivered healthcare, brought in universal healthcare to Canada. And what that means as a parent, I think about the fact that you could be the parents that are working in any job, where you could take your kids, if you're in Toronto, you can go to Sick Kids, one of the best pediatric hospitals literally on the earth, one of the best ones in the world, and you don't have to worry about how much it costs you. The only thing you worry about is maybe the parking, which you probably got to bring down a bit. But you could be at the Stollery in Edmonton, you could be at CHEO in Ottawa. You literally can go to some of the best hospitals in the world for your kids, and you could be the child of someone that works in a factory. You could be the child of someone that is a CEO. And you're all going to go to one of the best facilities in the world to get care. And that was really the vision of our healthcare system, that it should be there for everybody, that no one should worry about how much they earn. They shouldn't have to worry about spending money out of pocket. And the reason why we have a healthcare system like that is because it's based on our values. And our fundamental value, one of the things that we are really proud of as Canadians, is that we want to take care of each other. We believe in taking care of our neighbors. We believe that we are better off when we take care of the people around us because all of us benefit from that. That is what makes us Canadian and something that we're really proud of. But the reality is our healthcare system is eroding in a serious way. This SOS for healthcare is really appropriate because we're in a really tough spot right now. We've got a healthcare system that has people waiting for 10 hours, 12 hours in an emergency room. People waiting for years to get some of the care that they need, whether it's a knee replacement or a hip replacement. People are waiting far too long to get the care they need. And on top of that, we're seeing more and more people are having to pay out of pocket. People are spending to be able to get care. And that is never the vision of our healthcare system, but more and more that's happening. And the crisis that we're experiencing right now fundamentally is we do not have enough healthcare workers. And the reason behind that, the reason that underpins the crisis in our healthcare system is conservative governments that have cut funding to our healthcare system. So you got conservative premiers that go around saying, oh, look at healthcare, it's broken. And I want to scratch my head and say, well, yeah, because you broke it. It turns out if you break something, lo and behold, the thing is broken. The logic follows. If you go about breaking something actively, you underfund it, you don't hire enough workers, you bring in a private system that steals all the workers away from the public system, then the wait times get longer. And then they turn around and say, oh, look, the public's not working. We got to bring in more private, which makes things even worse. And that's what's happening again and again. You know, we're up against a real serious threat. This threat of Donald Trump. And he's talking about making us the 51st state. I was hoping to hear louder boos to that. Okay, that's what I wanted to hear. Now, what does that actually mean, though, to become the 51st state? When Donald Trump talks about the 51st state, he's saying that he wants Canada to be more like America. Well, he wants to replace our Canadian healthcare system with an American healthcare system. Well, to that we say, hell no, we don't want that. We don't want that at all. We want to defend our public healthcare system. But to defend our Canadian values, we don't defend our Canadian values by becoming more like the States, by doing Donald Trump's work for him. And that's what we're seeing from some conservative premiers. What Danielle Smith is doing Donald Trump's work for him. When she sells or puts the care of our public hospitals into the hand of private corporations, she's making Canada more like America. When Doug Ford sells off pieces of our healthcare system, privatizes, he's making our Canadian healthcare system more like the American system. He's doing Donald Trump's work for him. And when Pierre Poilievre says he wants to privatize and cut healthcare, he's doing Donald Trump's work. He's doing the same thing. And let's be clear about Pierre Poilievre. He has been very clear where he stands. He wants to cut healthcare. He wants to privatize healthcare. But I can give you more, just his motivation. A month ago, not too long ago, he met with I gotta get this name right here. He met with an Aaron Stern. Now you're wondering, who's Aaron Stern? Aaron Stern is the CEO and owner of Medical Facilities Corporation. This is a for-profit corporation that owns multiple private hospitals in the U.S. So Aaron Stern hosts a fundraiser for Pierre Poilievre in his multi-million-dollar mansion in Montreal. And he invites his billionaire and multimillionaire buddies to donate to Pierre Poilievre. What do you think Pierre Poilievre promised Aaron Stern and his buddies in exchange for those donations? Well, clearly, an opening to privatize healthcare to make his buddies more money. So we're under a serious threat, my friends. We're under a serious threat to our healthcare in Canada. And what's been the response to this threat by the current government, by the Liberal government that's had the power to do something about it? What has their response been to this serious threat to our healthcare system? They've really just let it happen, to be honest with you. They haven't done what they could do with the powers that they had. They really haven't stood up and defended our public healthcare system. Let's talk about how deep that erosion has happened. When we look at what's going on in Ontario, actually it's happening across the country, but Loblaws, big corporation owned by Galen Weston, they've got Maple. It's a for-profit healthcare delivery that charges Canadians $80 a month to subscribe, to be able to sign up, to be able to see family doctors. That's just the thin edge of the sword. We got so many more examples. People are paying thousands of dollars to see specialists. People are paying out of pocket to jump the line. We're already experiencing so much private care in our country. And what have the Liberals done? This has happened under their watch. Just let it happen. They've let Danielle Smith go ahead with privatizing hospitals. They've let Doug Ford go ahead with this. What about using the Canada Health Act? What about fighting back? What about using the negotiations to say, no, not a single cent of Canadian public federal dollars are going to go to for-profit care? They haven't done that. That's what we should be doing. Et au Québec, on a aussi des grands défis. Au Québec, à ce moment, plus de 2 millions de personnes. Je vous donne quelques instants. I'm going to give you a couple of seconds. I see people doing the switch. I didn't realize. That's great. You got translation. I just was going to do it anyways, but now you can hear me in French as well. Donc, au Québec, on a 2 millions de personnes. 2 millions de personnes au Québec qui n'ont pas accès au médecin familial. C'est fou. C'est inacceptable. Et c'est quoi la réponse du Premier ministre Legault? Il propose, et il a coupé des millions de dollars dans les soins de santé. Et à ce moment, ça ne marche pas. Cette approche de couper en même temps que les gens n'ont pas accès aux services dont ils ont besoin, ça ne fonctionne pas, ça ne marche pas. Et Donc, c'est quoi le choix pour les Québécois? Ils ont vu les libéraux laissent les grandes entreprises privatisées, laissent les premiers ministres comme Legault privatiser. On a les conservateurs de Pierre Poilievre qui veulent accélérer cette privatisation et le Bloc qui aussi laisse les entreprises faire ce qu'ils font. Ça, c'est ce qu'on a vu. Donc, on est le seul parti qui est prêt de défendre notre système de santé et améliorer notre système de santé. I was hoping that once that translation landed that you would applaud to that, but maybe. But let me tell you though why this matters to me personally. Like, why do I care so much about public health care? I've shared some of my story with you before. I've shared how my dad struggled with an addiction. Maybe this part though I haven't shared as much detail. So my dad, someone I admire and someone who's an incredible person, was struggling with a really a bad addiction. At the end stage of this addiction, he was an alcoholic who stopped eating and was being hospitalized pretty regularly. And it got to the point where some of his colleagues were in the hospital with him as a physician. His colleagues were the ones that would be at the hospital. And they told him pretty directly that if he continued, he would die. That if he didn't get help, he was on track to lose his life. Like, that was a reality for him. And if you've ever met someone or known someone close to you that struggled with an addiction, there's a moment that happens when they say they want to live, that they want to get help. And that hit my dad when he was in the hospital bed. It hit him that he wanted to live. He had hit rock bottom. He said, I want to live. And at that point, my dad had lost his job, had no insurance. We had no money. We were losing our home. We were in rough financial shape. And my dad wanted help. And so we went out and tried to find him that help. And we could not afford a private rehab center. It was not at all something that we could imagine. So we found a publicly funded rehab center in Windsor that had a bed, and we got him into that bed. And that public rehab center saved his life. And my dad is a physician to this day. He practiced, he cares for so many people, and he is only able to do that in a beautiful symmetry because he provides healthcare in a public healthcare system. He's only able to do that because the public healthcare system saved his life. And so I care desperately and deeply to keep our healthcare system public. I know it is fundamentally wrong to me that we would deny care to people because they can't afford it. And it is so right to me that we have a healthcare system that should be there for everyone, no matter what they earn, no matter how much is in their bank account. And I want to defend it. I want to fight for it. And I want to call on all of you to fight with me together to defend this healthcare system, because no one else is going to do it. No one else is going to do it. And so as Prime Minister, I commit to you, I will ensure that everyone in our country can access a family doctor. That is a fundamental thing that everyone needs to access. And we're going to address the problem directly head on. We have a staffing problem in our healthcare system, so we need to train, we need to recruit, we need to retain and respect healthcare workers. Fundamentally, that's what we need to do. And when we talk about respecting healthcare workers, what does that mean? Well, it means paying them well, because these are important jobs doing important work for us. We've got to make sure they're well paid and that they're not overburdened, that there's enough of healthcare workers so that workers that are in those fields aren't being burnt out, they're not being overburdened and stretched thin. When Tommy Douglas started healthcare system, his goal was clear. He said, healthcare should be there for everybody and you should not have to pay out of pocket. And what we're seeing now is, though, there are loopholes in our Canada Health Act that are being exploited by corporations. And the loopholes mean that when someone calls up a doctor, sees someone on their laptop with a Zoom screen, or texts a doctor or a nurse practitioner, they're getting charged for it. That should never be allowed. That should not be allowed. In a Canada that I want to see no cash for care, no money being spent to be able to get the care you need. And so we're going to crack down on that. We want people to be able to access healthcare in different ways. For sure, you should be able to call and be able to get access to healthcare. Maybe texting and using your laptop are great ways to get care for folks in rural and remote areas. but it shouldn't be something you have to pay for. It should be part of our public healthcare system. It should be part of our healthcare system that's public. And so we're going to modernize the Canada Health Act to crack down on this, to end the loophole, to make sure that no companies can charge you for care. And we're going to crack down, and we're going to make sure that provinces, we're going to force them to put in place fines, so that if a company tries to make money off the pain of Canadians, they get fined for doing that. We're not going to encourage them, we're going to fine them for doing that. So I'm putting Galen Weston on notice. I'm putting anyone who wants to privatize our healthcare system on notice. We're going to fight back because we believe in this thing. We believe in strengthening it. We believe in keeping what we have and improving it. Everyone in our country should get access to the best quality care possible, and I'm going to fight to defend that. And a part of what I want to also say is, of course, we need to recognize internationally trained healthcare workers, a part of our solution in having more workers. We got to recognize them. I also want to cheekily talk to American healthcare workers. If you're an American healthcare worker right now who is fed up with what Trump is doing, who's scared if you provide reproductive service healthcare and you're afraid, I want you to know that you can come to Canada. I want to streamline healthcare access for healthcare workers in the States to come to Canada. If you're a physician, if you're a nurse, and you want to provide those reproductive services, you want to provide healthcare where you can care for someone and not turn them away because they don't have the right insurance plan, because they don't have enough money in their pocket, come to Canada. We'll welcome you. So I need you to believe in this. The fight is so important, but the fight is, we've got to choose the right side. Who's going to actually be in it for you? Who's going to fight for you? The Liberals have chosen, by choice. I've seen them do this again and again. They've chosen to let Daniel Smith and Doug Ford and private healthcare walk all over our universal healthcare system. They've chosen that. They've chosen to let that happen. They've chosen to sit back and watch as it happens. That is their choice. And Pierre Poilievre has chosen his for-profit billionaire buddies to privatize our healthcare system. That's his choice. I choose you. I choose nurses. I choose doctors. I choose healthcare professionals and a public universal healthcare system that I want to defend. Now, I know you're going to hear people say, oh, it's impossible. You know, you can't do this. This fight's too hard. It is a big fight. It is a serious fight. It's a fight worth fighting. And I can tell you, I've been told my whole life, can't happen. Can't do it. Impossible. I was told it was impossible to expand our healthcare system. I was told no by the Liberals multiple times when I said, let's bring in the dental care program. They said no. They said, no, we're not going to do it. I had to fight them. And as a team, we fought them. And we brought it in. And now 1.5 million Canadians have received dental care because we fought and forced this government to do it. They told us no multiple times when we said we want to have pharmacare. They said no. I said we need pharmacare legislation and we need to start covering medication. They said no. And we got that done as well. We got the funding. We got the law passed. I don't know why they're not signing deals, but they should be signing deals. And I put this to you. You know, things are impossible until someone shows that it's not. It can't be done until someone does it. Jack Layton told us again and again, and it's something that I carry with in my heart. He said again and again, don't let them tell you it can't be done. I won't let them tell you it can't be done. If we're together, nothing is impossible. We can defend our healthcare, we can strengthen it and keep it public and keep it universal and make sure no one pays out of pocket. That's my commitment to you. Thank you.
Thanks, everyone. I welcome. We're going to have a little chat if you are figuring out the format now. And I'm really happy to welcome Dr. Brandon Doucet to the conversation, who is a strong advocate for public dental care. Linda, I needed a prop. Now I have to read the book title or else I'm going to get it wrong. because I didn't bring my book, is not only the founder of the Coalition of Dental Care, is author of About Canada Dental Care. And we know that this movement for public health care needs all aspects of us pushing and expertise, and we're so happy that you're part of that, and so I'll pass it over to you.
Thank you. I would like to start off by thanking you, Jagmeet, for your perspective and everything you've done to bring dental care to the national agenda. Before the Canadian Dental Care Plan, Canada's rate of public dental spending as a share of total dental spending was second worst amongst OECD countries, ranking even worse than the Americans. Now, as you've mentioned, 3.4 million people have gained coverage and 1.5 million people have been able to use that coverage. This is the largest investment in public dental care in Canadian history, but it's not without its hiccups. First, people who make less than $70,000 per year were originally promised no co-payments, but with the allowance of balanced billing, this has created about a 15% copay. Second, the income cutoffs for the program have not gone up with inflation, meaning the program has effectively been cut before it fully gets off of the ground. And third, with the Liberals dragging their feet on expanding the last phase of the program and an early election looking imminent, this last phase of the program for those aged 18 to 64, which is the biggest, encompassing 5 million people, might not benefit from this program. So with this, and even if we're able to get the Canadian Dental Care Plan fully in place, we still have a very privatized dental care system. 4.4 million people would be left uninsured, even more underinsured. We see the corporate takeover of dental clinics and overtreatment still being prevalent problems. So with all of this, I would like to ask, how do you suggest we harness the momentum of the Canadian Dental Care Plan and build off of that to achieve universal dental care?
Elect a new Democrat government. Seriously, that is the only way. I can tell you with all honesty, we had to fight tooth and nail to get to where we are. To give you a bit of a sense, every turn, at every single turn, the Liberal government said no to us. When we first proposed it, they said no. When I put forward law to make it happen years ago, before the agreement, they said no. When we said, okay, we've got this agreement, we need first part in place by this year, they said no. Every single step they said no. We had to fight them, and we had to drag them literally to make this happen. And they always tried to find an excuse, and we eventually made them do it. But it became very clear to me they are not serious about this. They just don't really want to do it. And with the final phase, all of the legislation, all of the laws, all the funding was already in place for them to move forward on the final phase, and they refused to do so. So I mean this with all honesty. If you want to not just defend public health care in general, if you believe in dental care for Canadians, you have to elect New Democrats. It's the only way it's going to happen, because the Liberals simply will not do it.
Thank you.
No, appreciate that. And I was at a meeting last week, and the most powerful part of it is that someone stood up and held their dental card in near tears, talking about how it changed their life. And I understand it's about balance of finances and it's all work, but if we remember people, I tell you, you get more moments like that, and it breaks your heart to know that there's folks that don't have access, and we need to grow that. So thank you for being there. I'm standing up because we want a couple questions from the audience, but it's hard to swivel in a chair. Okay, perfect. We're going to start, and you know how this is. We're timed, and so we'll take some questions, and we're going to answer them all. So I saw you first here, sitting beside Linda, and then next I saw you over at this table with the nice, it looks floral, but anyways, designed shirt over there. Perfect. Go ahead.
Hi, thank you so much. Avi Berzeau, professor at the University of Ottawa and lead of the Canadian Health Workforce Network. My question is, why the persistence on the focus on family physicians? Number one, primary care is very important. Mathematically, it is impossible to solve the primary care crisis with family physicians alone. It also doesn't recognize that 10% of the working population are health workers in Canada, many of whom work in primary care, nurse practitioners, social workers, pharmacists, optometrists, midwives. Why aren't they mentioned? I'm really curious about this.
Yeah.
Thank you. We'll take your question. Oh, it's right behind you, the microphone. Yeah.
Bonjour, OK. Je vais la dire en français. Je suis Sophie Verdon, coordonnatrice de la Coalition Solidarité Santé. On est une coalition provinciale qui défend le système public. D'abord, ce que vous avez dit, ouais, sur le Québec, on a des gros problèmes de privatisation. Merci de l'avoir acknowledge. Ensuite, au Québec, on a un régime d'assurance médicaments hybride et ça ne fonctionne pas. On a des gros problèmes avec ce régime-là. Les coûts explosent. Peut-être de l'extérieur, les gens ont l'impression que c'est un régime intéressant, mais ce n'est pas le cas. Donc, je voulais savoir, qu'est-ce que vous pensez du Pharmacare Act présentement? Parce que, selon nous, c'est très incomplet. Puis, de toute façon, les provinces ne sont pas en train de signer des accords. Et puis, on est inquiet sur le fait qu'il y a juste 2 médicaments. On trouve que la loi est un petit peu soft, on va dire. On aurait aimé ça avoir une loi plus claire pour un vrai régime d'assurance médicaments universel, public, accessible.
Merci pour la question.
Merci et, pour votre question. Et un mot, in the white, sorry, I saw your hand next, so we'll take that question and then we'll go to the answer. Thank you.
Thank you so much. I hope everybody had breakfast today. Well, my reason for asking, this is what I want to ask about. This, everyone needs it, right? Everyone needs food. And we are considered essential workers in COVID when everyone is being told to stay home. I want to know, why aren't we getting the access to the things that we're paying? Everything we pay all the taxes just like a Canadian citizens, but we get none of the benefits. We have to pay out of pocket when we go to the hospital. Everything that we need, we can't access, even though we're paying into everything. And instead of giving us the health care, we're being repatriated when we're injured. So I want to know how you plan to fix that. And we're asking for status on arrival for migrant workers so that we can access. Thank you. So we can access healthcare, we can access medication, and when we're being treated so ill by employers, we can actually get another job. We are here to work. We are not here to live off the system. We are not from a place where we go to soup kitchen. We are hard workers, and we believe that we are entitled to the things that we're paying into, and we're not accessing that any at all.
Thank you very much. Those are 3 big questions, but I'll pass it over to you to get your response.
Thank you for the questions. I'll start with the last question. Yeah, you should get status on arrival. I think that's a strong argument. We want to fundamentally change the way we do immigration. If someone's good enough to work here, they should be good enough to stay here and be a Canadian citizen, be a Canadian permanent resident. We think that the exploitation of workers through temporary work permits, through other forms of immigration that don't allow people to have a meaningful life in Canada, have led to more exploitation. If workers come here, they should be able to access health care, they should be able to contribute to the system, and they should be able to be part of our Canadian fabric. So I think we need to fundamentally change that.
Sorry, we have to go through the other questions, but I hope you can follow up after.
Sure,
but yeah, maybe the other 2 questions that we heard too.
Donc, la question de la science médicaments, vraiment importante. Donc, je prends un moment pour expliquer et pour les gens d'utiliser leurs écouteurs. Parfait. Donc, on a un système hybride au Québec, comme vous avez expliqué, et c'était à l'époque avant-gardiste. On doit être honnête, c'était à l'époque, c'était quelque chose de complètement nouvel, et on a pensé que c'est incroyable d'avoir cette couverture. Mais comme vous avez expliqué, la madame a expliqué excellent, vous avez le fait, que le système hybride, on a trouvé que ça coûte trop cher. Et c'est exactement pourquoi on a forcé le gouvernement libéral d'ajouter le langage des mots spécifiques dans la loi canadienne sur la science médicaments, qu'on doit avoir un système qui est public et universel. Parce que le système hybride, ça ne fonctionne pas. C'est trop cher, pas seulement pour l'État, parce que ça coûte trop cher pour l'État, c'est aussi trop cher pour les travailleurs au salaire minimum qui doit donner, vous savez, parce que vous êtes partie de la coalition, mais pour les autres gens, il y a une règle, c'est la loi, que vous devez payer pour une assurance privée. Et pour un travailleur de salaire minimum, ça prend une grande partie de leur salaire de payer pour cette assurance privée. Donc, c'est vraiment un système qui ne fonctionne pas. Ça coûte trop cher. Donc, on utilise comme preuve qu'on doit avoir un système qui est universel. Et comme j'ai dit, moi, je crois profondément, on a déjà dit ça dans nos campagnes électorales, qu'on veut mettre en place une assurance médicaments entièrement publique, entièrement universelle, parce que c'est une meilleure façon de livrer ce programme et ça peut économiser l'argent pour les provinces, pour les travailleurs et même pour les entreprises qui fournissent un programme privé. Donc, ça peut sauver l'argent pour tout le monde. La seule partie qui ne veut pas avoir cette sorte d'assurance médicaments, c'est les grandes entreprises pharmaceutiques, parce que ça donne la puissance au pays pour négocier les meilleurs prix pour les médicaments. Donc, c'est une meilleure façon de gérer notre système de santé. Je suis pour ça et un gouvernement néo-démocrate, je m'engage, doit mettre en place une assurance médicaments universelle parce que c'est la seule façon d'aller de l'avant. On est le seul pays au monde qui a un système de santé universel qui n'inclut pas un système d'assurance médicaments universel aussi. Donc, je crois profondément dans ce programme. On a plusieurs personnes qui payent trop pour les médicaments et on sait que si on ne peut pas aborder les médicaments, ça coûte le système de santé en général. C'est mauvais pour la personne, mais c'est aussi mauvais pour le système. Donc, je pense que vous avez raison et on va continuer de faire le travail nécessaire et un gouvernement néo-démocrate mettre en place une assurance médicaments universelle tout de suite.
Et la première question?
Yes.
Yes.
And the first question, great question. I think that the reason we talk about family doctors, I think it's something that's accessible to people. They say, I don't have one, I need one, I want to get one. But I worked in a community health center when I was in university. And the community health center that I worked in was in Windsor. And it was a Sandwich West Community Health Center. And I didn't know about this as a university student. And I learned about it when I worked there. The incredible wraparound services. Someone would come in and they had an ongoing chronic illness, and it was because they had an issue with their diet, and so a dietitian was a part of their care, and the dietitian would help them, and actually the illness that they kept on coming in for was something that could have been treated with a change to their diet. Someone had a respiratory issue, and it was coming from the place they were living, and the social worker actually got them better living, and then it helped them with the respiratory issue. So, and nurse practitioners were used very heavily in that model, and were able to provide care for lots of people. It delivered lots of care, high quality care, and the results were incredible. So I really believe in that model, and we've seen New Democrat governments put in place these kind of care models where instead of focusing on just having family physician practices, you have care centers which have a multitude of professionals together providing care. I think midwifery is an incredible source of providing great care, and also it's a lower cost care for families, and it's an excellent option. So all these things are a part of a healthcare solution. I think for me, the short form is to say everyone should get a family physician because that's what people want. But really, the solution to our healthcare system is utilizing all these underutilized, incredible professionals in a better way and having them provide that care more directly to people in a kind of system-wide approach. And that's how we're going to have a better healthcare system with better outcomes. So I absolutely believe with what you're saying.
Okay, well, thank you so much. And I do see more hands, and I think we could have had each of these morning sessions last all day, but that's not the schedule we're on today. So please, thank you, Jagmeet, for being here. Thank you, Dr. Doucet, for joining us. And please, big hand of applause for their time.
Thank you. And if I could just also add a big thank you so much. A big thank you to Dr. Doucet. The idea of bringing dental care to the national stage was something that a lot of folks worked on way before we proposed this idea and wanted to move forward with it. So I just want to acknowledge all the folks that came before and were advocates for it, and Dr. Doucet being a really loud voice amongst those. So we can't really achieve anything without the people that come before, and I just want to acknowledge that that your great work is how, and many folks like you that promoted this idea that dental care should be health care is why we got to that point.
Thank you.
Donc, oui, j'ai vu quelque chose d'intéressant. Karina Gould, une candidate pour la chefferie, a dit quelque chose qu'on a dit aussi. Je m'excuse, je recommence. On a vu récemment que Karina Gould, une candidate pour la chefferie, elle a dit récemment quelque chose qu'on a dit aussi. Elle a dit qu'elle est inquiète parce qu'elle a peur que Mark Carney propose de couper dans les soins de santé. Et dans ce moment, on est ici à cette conférence et on a des gens qui disent que c'est la mauvaise chose à faire, qu'on doit investir davantage pour protéger et améliorer notre système de santé, pas le couper. Et Karina Gould, un candidat pour la chefferie, a dit que notre candidat pour la chefferie, Mark Carney, veut couper dans les soins de santé. Je pense que c'est une mauvaise chose à faire. On a déjà vu un gouvernement libéral qui a laissé les entreprises privatisées, laissé les provinces de couper dans les soins de santé. Ce n'est pas ce qu'on veut faire. On veut défendre notre système et améliorer notre système.
Mr. Singh, every opinion poll we seems to show that the NDP are leading support to the Liberals. Should you still be leading at this time, given the fact that you are having problems getting your message out there to Canadian voters, Canadian constituents, and feel you might not be the right person to lead at this time?
I absolutely should be leading. I will be leading. And there's an important decision for Canadians. We're seeing already some early signs of what Mark Carney and the Liberals are proposing. They're proposing to cut healthcare. We're here at a healthcare conference literally called SOS because our healthcare system is in crisis, and Mark Carney is proposing to cut healthcare, to cut the operating budget for our country, which literally means cutting services, which will make it harder for people to get healthcare, will make it harder to get access to a dental care or to a doctor, will make it harder, even dental care as well, will make it harder for people who are waiting so long in an emergency room. And we know that Pierre Poilievre is openly talking about privatizing healthcare and cutting healthcare services. So for Canadians who want to defend healthcare, who want someone who's going to fight like hell to keep it Canadian, not let it become American, like Doug Ford is doing in the province of Ontario, like Daniel Smith is doing in Alberta. If you want to keep it public and universal and defend it and improve it, I'm your choice.
The conversation is about the 51st state. That is what is consuming Canadians. And your message isn't resonating. Is it possible that Canadians don't feel that you have the credentials or the ability to be that countering voice to Donald Trump?
Well, we think about what does that mean, the 51st state? When Donald Trump talks about Canada becoming the 51st state, we're here at a healthcare conference. Well, what would that mean for our healthcare? It would mean having American-style healthcare. American-style healthcare is one where you go into bankruptcy. The number one cause of bankruptcies in America is because of a healthcare cost. To have an American-style healthcare system, one that's private, where you spend money out of pocket. Well, the Liberals have let that happen in Ontario. They've let that happen in Alberta. They've let Daniel Smith, who's on the verge of basically selling off all the public hospitals to let them be run by a private corporation. We have Doug Ford that's been privatizing healthcare. So clearly the Liberals can't stand up to the idea of a 51st state when it comes to healthcare. And Pierre Poilievre wants to accelerate that, wants to make us more like America, sell off our healthcare system, privatize it so his buddies can make money. So if you want to defend healthcare, I'm your guy. I'm the only one that's committed to defending healthcare, fighting back against privatization, not letting people profit off the pain of Canadians, keeping it public and defending it, making it better, improving it, making sure you access a healthcare professional, a physician, a family doctor. That's me. That's New Democrats.
NDP supporters are shifting to the Liberals. How are you going to stop that?
We got to make sure people know the choice in this election. The choice in this election is you've seen 9 years of Liberals. Anything they promise you, they had 9 years to get it done. Is your life better? Is it more affordable to buy a home? Are your groceries more affordable? No, after 9 years, it's more expensive to buy groceries, more expensive to buy a home. They've had 9 years, almost a decade, and your life is worse off. And now Mark Carney is talking about doing more of the same. He wants to cut healthcare. He wants to allow our healthcare system to become more like the American system. I think that is wrong. And Pierre Poilievre is going to cut the things that you need, and it's going to cost you. I want to defend what we have and improve it, make it better, and lower your costs. Who's that? Well, he should comply with all the rules that any other member of parliament or any other elected official should follow, and I expect that that will be the case. But what I'm worried about Mark Carney is that he is someone who has made it clear what he wants to do with Canada. He wants to cut jobs. He's talked about cutting the public service at a time when we're up against a potential recession and a loss of jobs. He wants to fire more people, and he wants to cut our health care when we're literally at an SOS conference talking about the emergency in our healthcare system. He wants to cut it. I think those are bad decisions that will hurt Canadians, and I think those are the wrong things to do. Well, I think Canadians are really angry at the threat of Donald Trump and Elon Musk, his billionaire buddy, attacking our sovereignty, attacking who we are, and people are expressing that anger and expressing that frustration. And I think Canadians are really doing an important thing when they say we're not going to buy American, we're going to buy Canadian, and expressing that anger and frustration because we don't want to be like the United States. We don't want to be the 51st state. We want to defend our country and who we are, and that's exactly what I want to do. I want to defend our values. Our values are taking care of each other, taking care of our neighbor. That's what our healthcare system is founded on, the idea that we defend one another. We take care of our neighbor, and you don't have to pay money out of pocket to see a doctor. That's what I want to defend and improve, so we get better healthcare access, less wait times, more access to family doctors. That's what we need. Well, I think that question no longer is relevant anymore, given that Mark Carney has made it pretty clear that, and from what we hear, they're going to be calling an election in a couple of weeks. And so they're going to be calling the election. We're going to be prepared to fight it. Well, I'll take that question in two ways. One is that's not something that's on the table. No, there's been no discussions of that nature. And we understand that they want to call an early election. We did say, though, as early as early February, that if the government is interested in getting things done for people, putting in place a package to support workers who might be impacted by the tariffs, bringing in the changes that the public inquiry into foreign interference requested, changes to laws, there are things that we can get done. Let's call Parliament back and get those things done. We still have time to get those things done now. If the government's serious about this, if the Liberals are serious, I call their bluff. Let's get it done now. And I don't think any opposition leader would be opposed putting in place a package of supports for Canadians impacted by tariffs. I don't think anyone would oppose that. So put in place those ideas, put them forward and put them in Parliament. If they're serious about making that happen, go ahead. But otherwise, we're preparing for an election that Mark Carney is probably going to call in a couple of weeks. Thanks so much. Thanks.